Hi, this is Dr. Jim Anderson, and I'm about to go into our operating room suite here to do some procedures on Audrey, who's had restless legs for many years, and very hard for her to function. She's very tired, can't sleep at night. A lot of you know what that's like when this is a very serious condition. And we've been able to reverse restless legs for several years now, and we're really the first facility in the country where we have started to do intraoperative nerve monitoring. And that's what you're going to get to watch here in just a minute when we go inside. But basically all that is before the nerve tunnels have been opened, and we're going to show you one specific tunnel that we are going to be operating on, but before we open up that tunnel, that squeezing and compressing on the nerve, we stimulate the nerve. We see how much of a message goes into the muscle that nerve innervates. And then we go ahead, get rid of the pressure on the nerve, and then we do that test one more time at the very end. So we're able to actually measure objectively that the nerve is working better after the tunnel's been opened. Very exciting type of technique that we use, and we use it a lot for documenting our success, for helping to substantiate this with research that we do. So stay tuned, and we'll be going inside momentarily. Hi, this is Dr. Anderson. We're in the operating room, as you can see, and this is the patient's leg. Patient's asleep. We don't use general anesthetic. She's has some IV sedation, but she's had a block up above the knee, so she's good and numb. And you can see these are electrodes. This is an electrode in a muscle here, and we have one over here. Momentarily, we're going to be operating on this side, open up a nerve tunnel called the common peroneal nerve, and we'll be back in a bit. And when we do this, you're probably going to see some muscle twitching. Patient's not going to really be feeling it, and you're going to hear some beeping, and the beeping noise is the stimulation that's picked up in these muscles that you're going to be seeing on a monitor over here. So we'll be back in just a minute. It's fully numb, so she's not feeling this, but we're getting the baseline number now. We're saturating the nerve with this stimulator and recording how much is going into one of the muscles. So,
okay, lift off. 281.
So this is a baseline number. It's 281, and that we measure that in millivolts for you electrical engineers there. So, but 281 is the baseline. Now we'll go ahead and open up the tunnel, get rid of the pressure, and we'll do a final number. So we'll be back in a bit. Okay, we're back in the operating room. We're doing the final number on one of the muscle groups here, and the beginning number was 281. And so we're going to see how much higher the higher number we get. And so we're going to stimulate the nerve again. You'll see the muscles twitch.
Lift off. 936.
Oh, so that was 936. That's awfully high. That happens sometimes. This patient started out at 281. So again, went from 281 millivolts to 936. So very excellent improvement. So hopefully you can understand what we're doing here, and then we're really helping these people by opening up these tunnels, getting rid of pressure on the nerve. And this is a great tool. It's showing in the operating room objectively that the nerve is working better, and therefore these patients get better with their restless legs. So I'm here with Audrey today, and she's about 5 days out from surgery, and she came to us kind of primarily with your foot.
Correct.
A lot of the symptoms were in the foot. Not so much in the leg, or at least it didn't come up in our conversation, but as I got to know her better, it turned out that she was getting restless leg symptoms and also some sciatic pain. And so, so three things, kind of foot, leg, restless legs, and sciatic pain. So, and just talk a little bit about that. How bad was all that?
The pain was pretty significant.
Mm-hmm.
I've had problems with my sciatica for years, not thinking anything of it. What brought me in, as Dr. Anderson mentioned, was my foot. And through our conversation, the pain in my leg, and it would wake me up at night, and didn't really realize I always equated everything to my foot. And as our conversation progressed, And the questions come to find out that I was suffering from restless leg syndrome. My husband used to tell me I always twitch, and you could watch my legs twitch and never even thought anything about it.
Right. So you woke him up, but
I would wake him up from kicking and thrashing around,
Yeah.
or you would sit in the recliner chair and watch my legs dance, but
it would wake you up a little bit at night.
it would wake me up.
Yeah.
Didn't sleep
Okay.
much or more than 2 or 3 hours at a time before my
Amazing.
legs would twitch, and I'd have to reposition to try to get it to stop.
So we already talked about this. You're only about 5 days out, and so tell people watching so far, what are the 3 things doing your foot and your restless legs and your sciatic pain?
My foot feels great. I cannot complain, which I haven't been able to say that for quite some time. In regards to my leg, I've been able to sleep through the night. I haven't noticed it. A little bit of pain from where the incisions are, but nothing bad. And currently I'm having no sciatic pain, so it'll be interesting to see what time.
And to be fair to the process, you did say to really test out the foot with activity. It bothered you more with more activity. So we're not quite at the point where you're active.
Correct. So I'm eagerly looking for when I teach for 8 hours and I'm on my foot for 14 hours and I'm active again. It'll be interesting to see.
Excellent. So I'm going to pan down here. And again, this is about 5 days out, but these are the incisions. If you don't mind, we're going to pan down here. This is an incision called for the common perineal nerve, and this is for the superficial perineal nerve. And then over here is the soleal sling. This is a nerve tunnel that's back behind the calf. So you're able to walk right away after surgery, right? Did you have much post-op pain?
I have more pain as the day goes on, but not horrible, nothing that wasn't manageable.
Okay, so pretty quickly you felt pretty good. Okay,
Yeah.
well, we appreciate it, and we'll let you go. I'll probably do another 1 or 2 of these.
Thanks.
Thank you.